The topics and opinions expressed on the following show are solely those of the host and their guests, and not those of W4CS Radio, its employees, or affiliates. W4CS makes no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. Any questions or comments should be directed to those show hosts. Thank you for listening to the Cancer Support Network on W4CS.com.
Hello, everyone, and welcome back to Survive and Live Well, tips to treat and beat cancer. As always, my goal is to empower you with information to help you regain control of your health. Today, I have the pleasure of welcoming back Dr. Michael Schachter. Dr. Schachter is a leader in alternative cancer therapies and the director of the Schachter Center for Complementary Medicine in Suffern, New York. So, Dr. Schachter, this is the 6th time I've had you on the show, and I suspect that I shall meet you here again, as it seems there is no end to the knowledge that you have to share. And I know I'm not alone in saying that you have such a refreshing and logical approach to cancer and wellness, which, by the way, was very evident at the following that you had at the Annie Appleseed conference. And also, by the way, it was really a pleasure to finally meet you in person.
It was a pleasure to meet you too, Elyn.
Well, it's great. It was really a great opportunity because we've spoken for so long over the phone, and on the show that it was really great. And I kind of felt like your agent there because I knew that you wanted to chat with every single person that wanted. They surrounded you, asking with questions and interest. And I just didn't want you to miss that plane that you had to catch, so I kind of wanted to whisk you away. But anyway, I'm sure now after that it's been a very busy few weeks for you, so I appreciate your taking the time to be here today.
Well, it's just great to be here again with you.
Well, great. So before we get into some of my very specific questions, what I heard over and over again at the Annie Appleseed conference is the limitations of conventional treatment, especially with respect to killing stem cells. And also, I heard a lot of exciting information on the emotional contributions to cancer. But I was curious what your overall impression of the vibe of the conference was.
Well, I was very impressed with the conference, and I really liked meeting several people. It was great to meet so many people who have actually taken the path, and after being told, that they're really courting disaster by not doing conventional treatment, to see so many people who did do that and did not court disaster at all. In fact, they were really very healthy and feeling fine, and so on. And yet, there were also many people who did choose to do conventional treatment and at the same time incorporated some nutrition and other lifestyle factors into their program. And I'm absolutely convinced that those people do better than just people who get conventional treatment without any support in the lifestyle area and the nutrition area. But it was a pleasure meeting all of these people. It was a pleasure listening to many of the lecturers, and I really had a good time. Also, the fact that they served organic foods at the luncheons were terrific. Yeah, so it was just delicious, and I enjoyed that. I even enjoyed getting a little sunshine out there in the afternoon. You and I both took a little break a couple of times and got some sun, and that was great also.
I think it was much needed after this very, very long winter. But I love the patient panels because you hear the great stories and you realize that it's possible to either just take the alternative route or to really maximize both by using both, really maximize your care. And as you said, instead of just doing the conventional, by really combining the East and West and improving your outcome. So I love the conference. It's great.
Mm-hmm.
So my first question, during our recent interviews, you seemed very excited about the prospect of using relatively high doses of vitamin D for cancer patients and for patients with a wide variety of problems other than cancer. So, and I know we've spoken about D before, but could you explain what kinds of health problems may benefit from its use?
Well, it's almost easier to list the ones that won't respond because the list is tremendous. I mean, and I think later on we'll talk about why this is so. But leading the list, these things I'm mentioning now are are actually conditions for which there actually been interventional trials. That means they've been double-blind, placebo-controlled, randomized trials to show that vitamin D is beneficial. So leading the list would be anything related to bone issues, osteoporotic fractures, osteoporosis, osteomalacia, which is slightly different than osteoporosis because it involves pain. And there are a lot of people walking around with that condition that don't even know it, and the doctors don't know it either. But it turns out that some of them will respond beautifully to vitamin D, and a lot of their pains will go away because osteoporosis doesn't have pains; it's just the thinning of the bones. But that also responds. People, especially as they get older, people tend to fall, lose their balance, fall. There is a study showing, 5 studies showing that it reduces the incidence of falls when people are on vitamin D. High blood pressure is another one. There's one interventional trial with regard to cancer that's really interesting, and tuberculosis is another one. And to me, the idea with the tuberculosis is I would expand that, and even though the trial is just with tuberculosis, I would say it may have relevance for any kind of chronic infection. You know, this epidemic of Lyme disease that we're having and all of these co-infections, I think most of the doctors, either the conventional or even the Lyme literate, somewhat non-conventional doctors, focus on finding out what the organism is and then treating it with antibiotics and treating it with the various other drugs to try to kill the organisms. When I think if you get the vitamin D levels high enough, you may be able to take care of these infections on your own, because vitamin D stimulates some internal or natural antibiotics called antimicrobial peptides. Cathelicidin is one of the main ones, and that substance that vitamin D stimulates the production of is actually antiviral, antibacterial, antifungal, and antiparasitic. So vitamin D is something that you want to keep up to prevent infections, and also I think it may be playing a good role in terms of actually treating infections once you do have them. So infections are very important. There are 3 studies on respiratory infections and influenza, and that would go along with this idea with the tuberculosis. So also for pregnant women, it seems to be extraordinarily important to improve the outcomes of pregnancy and to reduce the number of cesarean sections that are needed. Also, there's a whole issue related to periodontal disease, and there's lots of research indicating that periodontal disease or diseases of the mouth and the gums are associated with chronic inflammatory infections that could increase risk for all kinds of heart disease and cardiovascular disease. So that becomes very important. And also there are studies related to insulin sensitivity and diabetes, people who have a tendency toward diabetes or the metabolic syndrome, people who tend to be overweight. All of these conditions should benefit somewhat. So as I said, it's hard to name a condition that either the ones I named or implications from the ones that I named, like the Lyme disease with regard to the TB and the influenza issues. It's rampant. It's all over the place, and yet there's not enough attention. Some conventional physicians are beginning to pay attention to it, because I have patients coming to me said that conventional physicians say, "Oh, I'm glad to see that your 25-hydroxy D level is up around 60." You know, and before. Certainly, the official position is nothing like that in terms of the levels of 25-hydroxy-D, the main status for seeing what the vitamin D status is in the body. That's the blood test that does that. The official position is much lower levels, and you really don't need vitamin D very much.
Right. You know, I'm always amazed at how many of my clients don't have that number. And I ask them, they say, well, my doctor didn't do that. I go, well, give me your blood, give me your results. It's got to be in there. And it's nowhere to be seen in their blood tests. And that's I agree that's a major issue, because doctors, if they're not aware of how important it is, they're not to do it. You know, it's probably not considered. I think it's generally not considered the standard of care. And so This is something, again, it's like a grassroots thing coming up from the bottom. The patients are demanding the tests, and when often I see the test, and I say, "Oh, I see your doctor." They say, "Well, that's because I asked them to do it." Right.
Not at all uncommon to get that answer.
Yeah, it's amazing. There's others like the CRP. I don't want to get it off on a tangent, but it's amazing some of the simple things that they could do that just It's not part of, as you say, it's not part of the standard of care. So how is it that vitamin D can be so helpful for so many conditions? I mean, what is it about this?
Well, this is also a very interesting thing that I've actually just learned about recently myself because I didn't really understand it. It turns out that vitamin D is so important in so many conditions because along with its receptor and vitamin A and its receptor, the two of them can combine to get into the nucleus of the cell and upregulate or downregulate genes. Now, you have a whole series of genes in the body that get turned off permanently during development, which tell you what kind of cell that particular cell is going to be. So certain genes are turned off to make it into a liver cell or a heart cell or a brain cell and so on. And once those changes occur during embryonic life, it's impossible for a brain cell to become a heart cell or vice versa and so on. So that's one issue related to genes. Other issues are there are genes that function throughout life. So there are pro-cancer genes and anti-cancer genes. There are pro-inflammatory genes and anti-inflammatory genes. And the body is in a constant state of interacting with the environment to affect the genes, which then affect the production of proteins in the cell to help it deal with whatever situation has come up. So what happens is that if there isn't enough of the vitamin D present, there isn't enough of it's not able to go in to make this combination of the A and the D and their receptors to go into the gene into the nucleus of the cell to upregulate the various genes that needed to be upregulated. And what the new thing about this, it used to be thought that vitamin D was made by in the skin from cholesterol when it was exposed to ultraviolet B rays, or it could be taken in terms of supplements, or a few foods have vitamin D in it. And when it gets into the body, this vitamin D goes to the liver, and a hydroxyl atom or hydroxy OH atom, oxygen and hydrogen atom, is added to it, becomes 25-hydroxy D, which is the main substance that we measure when we're checking the vitamin D status of the body, okay? Then what happens is, what I learned in medical school and what people in general are still learning to some extent, is that then the 25-hydroxy D goes to the kidney, and the kidney adds another hydroxy group on it, so now it becomes 1,25-dihydroxy, two hydroxy groups, vitamin D, and that's the active form. That's the form that actually goes into the nucleus and affects the cells. And it was thought that that's how it was done. But recently what has been shown is that's not how it works. Although the kidneys do produce the 1,25-dihydroxy D, and that does regulate calcium in the system, each cell has in it the capacity, it has the vitamin D receptors, and it has the ability to make this 1,25-dihydroxy D. And then once it does that, the 1,25-dihydroxy D can go in there and affect genes. It's like the 1,25-dihydroxy D is like a password that allows the genes to work properly, that it gets into this library of genes and tell which ones to go on and which ones to go off in order to adapt to whatever the situation is. And this is present in every single cell and every single organ in the body. So that's why the vitamin D, which is like this password to get the genes to work properly, is important in every single tissue. So that's why you can be so involved with so many different conditions and be so important.
Wow. Okay. Yeah. So for some reason, I guess I also thought that it had to do with the cholesterol and the sun rays, but that's great. Okay. We learned something new here. And so what would you consider to be the optimal levels that we should have in our body?
Well, I think, first of all, let's look at what is generally recommended. And what is generally recommended by the Institute of Medicine, the Food and Drug Board of the Institute of Medicine, they published guidelines in 2010, and they did not look at any of the studies that I mentioned except for the ones having to do with bone health. they said there weren't enough of them to even look at them. So they didn't even look at that. And then they came to the conclusion that people, bone health was fine if they can get their blood level at 20 and for sure 30. And what we're talking about here is nanograms per milliliter. And that's generally what is reported in the United States and in most of these labs, nanogram per milliliter. And they want it between 20 and 30, where they call, and some authors say, well, less than 20 is deficient and 20 to 30 is insufficient. Over 30 is fine. So that's what they say. And the Institute of the Vitamin D Council, which has consists of a lot of doctors and scientists who are very much involved with vitamin D research, disagrees, and they say that really the optimal bone health, you need at least 40, and they like to see it between 40 and 60 levels. And patients, like I just heard of a patient that's having a lot of problems with Panda syndrome, something involved with an infection of strep infections. Turned out his vitamin D, his 25-hydroxy was 16. And yet you hear this over and over again. People with having severe problems, they're all in their teens or in their low 20s and so on. And what I have been finding recently is that most of the studies, or many of the studies, are really related to prevention, and very few of them really focus on treating. And I think when there is some anecdotal reports, and my experience has tended to be that we really want to even go higher than the 60 in patients that we're treating. So we actually try to get blood levels of 25-hydroxy-D up between 60 and 100 and even closer to 100. But if you do that, you have to pay attention to a lot of things, and it needs to be monitored carefully, because you can get some types of side effects, even though the reported side effects, serious side effects, supposedly don't occur until you get above 150 level. I think that's probably not the case. I think you do get them, especially if you're deficient in minerals, if you're deficient in vitamin K2, if you don't have enough vitamin A in your system. In other words, you need a holistic approach when you're dealing with vitamin D. It's not just that vitamin D is a magic bullet and takes care of everything when you get to a certain level. You have to pay attention to the possibility you could get side effects unless you have these all working as a team.
Mm-hmm. So maybe you should talk about that relationship between D and those other fat-soluble vitamins that you just mentioned, the K2s and the A's.
Okay, well, K2 is something that really is fairly new on the scene. It's only been really researched carefully and talked about probably in the last, 10 years or so. Most people, when they think of vitamin K, think of vitamin K is involved in blood clotting, and that's what we learn in high school and college and medical school and so on, that vitamin K is necessary for blood clotting. And that's true, but that refers to the particular vitamin K called vitamin K1. Now, vitamin K1 is involved with clotting of the blood, and if you're deficient in some of the elements of that, or very deficient in K, which is a little bit hard to do, this K1, you do get a tendency to bleed too easily. The K2 has a different function altogether. The molecules are similar, but they're not the same, and the function is really quite different. It also activates proteins just the way K1 does, but the proteins it activates have to do with two major areas. One has to do with bone health and bone density, and the other one has to do with the accumulation of calcium in the wrong places in the body. So if you have calcium accumulating in your coronary arteries or in your joints, that's bad. You don't want that to occur. That will cause you symptoms, and that will cause disease. If you do not have sufficient calcium accumulating in the bone, that's going to give you osteoporosis. And it appears that vitamin K2's job is to make sure that calcium does the right thing. It goes where it's supposed to go in the body. And if people are deficient in K2, and let's say they take a lot of vitamin D and insufficient K2, why, they're likely to start accumulating calcium either in their arteries or in their joints, and that can lead to very serious problems. There's a wonderful book out by a woman, a naturopath from Canada, named Kate Room-Bleu. I think that's how she says her name. Anyway, it's called Vitamin K2 and the Calcium Paradox. It just came out a year or so ago, and it's a wonderful book, and it's very readable. I think anybody interested in the subject might want to get a hold of that book. It certainly was eye-opening to me. And so that's where vitamin K2 fits in this, and it's very important. The sources of vitamin K2, you can get it. There are two types of vitamin K2, MK4 and MK7. The MK7 is produced by bacteria, and the MK4 is produced in animals that are fed grass-fed animals or pasture-fed animals. And if you eat the meat or have the butter or the cheeses from those animals, you will get this MK4. The MK7 is found in certain bacteria, found in products like natto or certain cheeses. And both of them have a tendency to have this effect that I mentioned with vitamin K2, putting calcium where it belongs. For reasons I don't want to get into at this point because of time, I prefer the MK4, but most of the supplements on the market actually have MK7 in them. Anyway, so that kind of covers the vitamin K2, and it is available. Both of them are available in supplements and can be used. The other one, the fat-soluble vitamin that's really important with vitamin D is vitamin A. Now, vitamin A itself has many very important characteristics. It's tremendously important for any type of healing. Whenever there's a wound or there's any kind of a problem with the surface of the body or even with internal cells of the body, that requires vitamin A to heal. It also is involved with the immune system. And it turns out that vitamin A and D are actually partners. They work together. They each attach to their receptor, and then they join together to form something called a heterodimer, which then enters the nucleus of the cell to upregulate or downregulate various genes. So those are the most important. Vitamin E is also a fat-soluble vitamin. It's unclear exactly how that works, except it has an antioxidant to protect the other vitamins and so on. But the A and the K2 are extremely important, and I think anybody who's taking vitamin D should pay attention to their vitamins A and K2 as well. The dose of the vitamin A that I like is similar to what you find in cod liver oil. You find a ratio of vitamin A to D to about 2 to 1, and I think taking the same amount in international units of A and D, or making maybe somewhat more of A to D, is a very reasonable thing to do. Overdose of A is manifested by people having dry lips or headaches, or hair falling out, or joint pains. If they start vitamin A and they start getting those, that may indicate they're taking too much for them. Because all of this has to be individualized, including the vitamin D levels and so on. Like some people can take 5,000 a day of vitamin D, and their 25-hydroxy-D will be 50, and others may take it and it'd only be 30. So they may have to go to 10,000 units a day. So in other words, the dosage should to some extent be determined by the 25-hydroxy-D levels, which we're aiming for, what we're aiming for. And as I say, there's a bit of a controversy there. I tend to favor, especially when I'm treating somebody who's got problems, chronic infections, cancer, various other conditions, autoimmune diseases, I like to go high on the vitamin D and relatively and it's roughly equal amount of vitamin A, and make sure they're getting enough of the K2. The K2, the MK4 K2, the only studies that have been done on vitamin K, interventional studies, meaning they've done randomized placebo-controlled studies in people with various conditions. The MK4 has them. MK7 doesn't, and that's one of the reasons I prefer MK4. And the dose that is approved in Japan as a treatment for osteoporosis is 45 milligrams 3 times a day. And I usually use between 30 and 60 milligrams in most of the patients that I'm used for treatment.
Mm-hmm. Well, I think you make an important point that we shouldn't really just self-medicate and say, "Well, I'm personally going to take 5,000 or this amount or that amount." You really need to check your blood levels and have those checked and work with a professional. So I just want to remind people that would be the best way to.
Well, it's better to do it that way. Some people, on the other hand, there are people who are. They can't afford it, and the tests are not covered by insurance, and so on. So I would hate to totally discourage anybody from taking some vitamin D because they don't have a practitioner, although I think it's much better to have the practitioner who knows about these things. Unfortunately, most of the doctors really don't know too much about this whole area. But, it's reasonable for someone to take, 2,000, 3,000, even probably 5,000 of D and a similar amount of A, very unlikely to get into problem at those levels, I think.
Right, but I think if they were going to take excessive amounts, they should
if they're going to start taking 10,000, 15,000,
right.
20,000, then they absolutely should be under the care of a practitioner who knows what they're doing.
Exactly. So maybe you can talk a little bit about the inverse relationship between vitamin D intake and breast and colon cancer.
Well, the studies go back in the 30s and 40s. There was some 1930s and 40s. There was some suggestion that people who have higher exposure to sunlight and people who have higher vitamin D levels tend to have a lower incidence of cancer. This kind of was below the surface for many years, and then these PhD researchers from the University of California, the Garlands, Garland, did some studies, and they showed they would show maps, and they would show the maps of the country, and they would do a correlation between the incidence of various cancers like prostate cancer and colon cancer and breast cancer, and they could show that there was a pretty good relationship between an inverse relationship between the level of sunlight and the level of vitamin D in a person and the likelihood of them developing those types of cancer. And in my lectures, I show those slides of those of the United States showing that there is a very close relationship there. And so it's turned out that epidemiologically it seems very, very clear that there is a relationship there. And there has only been the one cancer study that's been done with vitamin D, the interventional study, was involving about 1,200 people out in the Midwest, roughly 1,200 postmenopausal women. And what they wanted to do was they wanted to see if they gave these women some calcium supplement and additional 1,100 units. Now, keep in mind, this is only 1,100. This is much lower than the doses we've been talking about, but 1,100 units a day, and they had three groups. One just calcium and 400 units of D, another group that same supplement plus 1,100 units of D, plus the third group was just a placebo. And they showed over a 4-year period they were able to reduce the incidence of cancer by 70% with just that intervention, which would be unbelievably inexpensive and just an amazing amount of, if this is true, imagine if it's like pennies a day, if that, to give people that kind of, to give them that kind of level, and it would show that that there was just tremendous amount of reduction, and what that would be in terms of the human value of it, but also in terms of the costs, because we're tending to go bankrupt because of all of our costs, medical costs, and consequently, I think that it's very clear. There's one study that was done, another at the University of California in San Diego, and they used computer models to predict how much breast cancer and colon cancer could be reduced by taking a modest amount, not even real high amounts, but modest amounts like, let's say, this 1,100 or maybe a little bit more of vitamin D and calcium. They could reduce breast cancer by 58,000 new cases in the United States and colorectal cancer by 49,000. And they felt that 75% of deaths from these cancers could be prevented by giving this small amount of vitamin D.
I think that would put
absolutely incredible.
It is. It would put a huge dent in our medical costs. So let's talk a little bit about sun exposure. Every dermatologist, and I know we've talked about this before, but I just want to talk briefly about the fact that, deaths versus skin cancer versus vitamin D. If you could just shed a little light on that.
Well, yeah, because, if you overexpose yourself to sunlight and you get sunburns, you will increase your risk of skin cancer, especially the basal cell cancers and the squamous cell cancers. So this is very important. But if you do a study, there have been studies now looking to see what would happen if you did expose people to sunlight, what would happen to the skin cancer rate, and what would happen to the deaths from the other major cancers that we talked about. And what this one study that I have indicates that that you would have 1 to 2 extra skin deaths per 100,000 with more sunlight. So 1 to 2 extra skin deaths, but you would have 30 to 40 compared to 1 to 2 extra deaths from major cancers, the prostate, the colon, the breast cancer. You would have a huge number, like 40 times as many deaths from these other cancers by not exposing people to sunlight. So this is the argument that people like Michael Hollick, who's the discoverer of 1,25-dihydroxy-D and a very famous researcher and the author of a couple of popular books on vitamin D, and he's been arguing this, and of course he's been tremendously ostracized by the dermatology community, who since the 1980s have said, avoid sun at all costs, don't go out in the sun, and if you go out in the sun, make sure you have this very high sun screening material on you to prevent yourself from getting sunburned and so on. But of course, that same material prevents you from getting any vitamin D at the same time. That's the issue. And the dermatologists and to some extent they've influenced all of medicine and everybody and the media to a great extent. Oh, you better be careful. Don't expose yourself to sunlight and this and that. And I think it's been overdone. And as a result of that, that's part of the reason that we're suffering from so much chronic disease is the lack of sunlight rather than too much.
Right, and you comment, yes, we will get more wrinkles if we're exposed to the sun, and we will up our risk for some of the other skin cancers, but it's important to know that for melanoma, which is really the most deadly of the skin cancers, isn't it something about 30% is sun-related? I heard that the other day at a conference. I was really amazed. 30% of melanoma deaths are related to, or cases are related to sun exposure. The rest are all genetic and have other causes. Oh,
other factors, yes. Well, yeah. Look, there's also, I think, you should keep in mind that depending on how much sun we're talking about, because it is a dose-response relationship that we're talking about. But if you're getting enough sunlight to increase your vitamin D and not causing sunburn, you are reducing your risk for melanoma because the melanoma, like these other cancers, are affected by the upregulation of the genes, the anti-cancer genes from the vitamin D. So again, you're looking at relationships, you're looking at how it's done, you're looking at various other variables and so on. So Mike, again, I really advise people to get some sunlight, not get burned, but expose themselves if they get into the season. If you've got very, very light skin or you're albino or something like that, no, you shouldn't be exposed to the sun. But the vast majority of people can be exposed to the sun. They just have to use some common sense, and they should not be covering themselves with sunscreen all the time.
That's right, especially the toxic ones. So I want to move on first now. So Dr. Schechter, we have spoken about sylvestrals before, so I don't want to get too thick into this, but if you could talk about some recent developments in China, are the conventional docs using them there and to what extent? And also maybe talk a little bit about sylvestral deficiencies, how we could be naturally deficient and what causes that, what we should be aware of?
Okay, well, I think that I just learned about this within the last month or two about what the research work not even so much research, the clinical work that's going on in China. This is not a pervasive thing throughout all of China. This is one hospital that is in actually mainland China, not too far from Hong Kong, and it appears that there was a fellow who was on the board of this hospital who was also lived in Australia, and heard about, and I think himself was on salvestrols, and apparently he started discussing the kind of results they had heard about and he had seen with the oncologists at this hospital. The name of the hospital is Renkang Hospital, Southern Medical University near Hong Kong, and this Dr. Zhao, a woman, and Dr. Wang, a man, are two, shall we say, card-carrying oncologists who began looking into this, and they have now been using this in this hospital, and they feel that this has been tremendously helpful. They say they're using it on all of their cancer patients now. They use it in combination with some conventional treatments, some alternative treatments. They're using something called sonophotodynamic therapy, which is not used very much in the United States, but also is a non-toxic approach. And here are two quotes that I've gotten from these doctors. One quote is, "Salvestrols have enabled the team to bring about reversal of the disease in very late-stage cancers where previously the greatest success was mainly with earlier-stage cancers." And the second quote is, all our patients are in better stable response to our treatment after adding salvestrol. So to me, this is tremendously important and exciting. So the developers of salvestrol have been over there. They're interested in using these researchers to help with diagnostic tests to determine if a person has cancer or to determine whether a person is responding to a treatment for cancer. Now, these tests are not available commercially yet, but the researchers are working on these tests, and hopefully at some point they will be available. I'd like to use them myself to see about whether my treatments are working as well. So that so that relates to what's going on in China, and hopefully it'll expand, and hopefully they'll continue doing this. Very, very exciting work.
It is, but before you go on to deficiencies, I just want to make a comment because I can't help myself.
Go ahead.
So here these doctors are using this. I would guarantee you that 99.9% of oncologists in the United States have never heard of salvestrols.
I think your estimate may be a little bit high. Maybe a little bit low, I mean.
Yes. I'm sorry, I just couldn't help myself. Okay, so on to deficiencies.
Okay, well, the oncology, it's not totally their fault,
No,
I mean,
it's
basically, this is not getting into their literature. This is, the people have chosen, this is a natural path rather than to go through the usual, to make this into a drug, to make it into a patentable item, and therefore it's not going to get into the conventional literature very easily, so people are not going to know about it unless their patients tell them about it. And then there are a few of them that are, they're intrigued by it. They're interested in knowing a little bit more, but the vast majority don't want to hear about anything they don't know anything about. As far as salvestrol deficiency, I think you can almost assume that because of what we've talked about and how it works, is that the vast majority of the population are deficient in salvestrols because, for one thing, it requires, in order to have high salvestrols in your diet, you need to eat organic foods, because these salvestrols are substances that are produced in response to it's like the plant's immune system against attack by predators. And if you are using pesticides and so on, you're preventing them from being attacked by predators, and therefore the plants don't produce the salvestrols. So the result is that in general, people are going to be salvestrol deficient. And the way that you can correct the deficiencies is, first of all, move toward using organic foods. And they're present. The many fruits and vegetables, the fruits come to mind because that's what's in the supplement of salvestrols, but like blackberries, blueberries, raspberries, strawberries, the peel of a tangerine. That's where the salvestral supplements are derived, are made from those substances. So by eating a lot of those will help to increase your salvestrols. And then there is a salvestral supplement that is available that people can also take lower doses, one capsule, let's say, as a preventive, and higher doses for people who are really challenged with severe deficiencies and cancer generally.
Right.
So,
and what about stress? Does stress, does that compromise our salvestrols, our ability to use them? How would that interact?
I think this just it really estimates that cancer is a multifactorial disease, and not just cancer. All diseases are multifactorial, and stress can play a role in virtually anything because stress makes changes in the body, increases your output of steroids, of cortisol, for example, and the result is that it can impair the immune system and impair your ability to be able to fight cancer or any other disease. So reducing stress, in China, for example, they are emphasizing this as a holistic approach, talking about diet, talking about stress reduction or management as part of the treatment for the cancer patients along with the silvestrols.
Great. Now, you're going to be speaking about silvestrols at a few upcoming conferences near and far, right?
Yeah, well, I have 3 conferences coming up. There's one that's going to be right this Sunday in New York City. It's a small, it's called, what's it called? Mondiwell.
Mondi, right.
Yeah, Mondiwell, and it's at the New York Hilton this Sunday, and I'll be speaking. Only 20-minute talk, so I won't have time to get into much things. But it'll be from 12:40 to 1 o'clock, and there'll be a number of other speakers. I think they're featuring Carol Alt, who has her own TV program now. She's very much into health. She's going to be there, and Sylvie Beljanski will be talking there. A number of other speakers. So that's this Sunday. It starts, I think, at 10 and it runs until about 6 p.m. Then the other talks are next month. I have one coming up in Reno, Nevada at the Best Answer to Cancer Conference, and I will be given 90 minutes there. And I'll be talking about a lot of things that we've been talking about on our programs together. It'll include silvestrols, but it'll also be including vitamin D and vitamin A and my view about the role of conventional treatment and the fact that maybe conventional treatment taken as a given is not the way to go. So that's one, and then so that will include several of the topics we've talked about. And then there's one up in Vancouver, Canada, up in on April 25th, Friday, and that one will be at the Orthomolecular Medicine Today conference, and that will be exclusively on silvestrols. So those are the 3 that I have coming up in the near future. I think
well,
there's also.
Go ahead.
I just also I should mention in May, I think the first weekend in May now, there's going to be an expo out in Long Island, and I will be speaking at that. I don't have any details on that yet, but I will be speaking about cancer and speaking about silvestrols at that conference also.
Great. Well, I'm hoping that all of this exposure changes that percentage that, that very low percentage of 99.9 that don't know about it. Hopefully a few more will catch on to it. So
right.
I'm glad that you're getting that word out there. Very, very important. And we're kind of running out of time here. So I have one more question I was going to ask you that we did speak about the limitations of conventional medicine quite thoroughly. And how, you even challenged that conventional medicine is the gold standard. But what we did not address is the fact that conventional treatment can interfere with the long-term results of cancer therapies. Either we can tackle that now or we can schedule another show. So
well, I think we can just throw out the concept. Most of the patients who come to me and are very much concerned, and most of them are also if they have cancer, are also being followed by conventional doctors, conventional oncologists, surgeons, radiation oncologists, and so on. And their first question often is, well, will the alternative treatments interfere with the conventional treatment results? Well, it turns out, the conventional treatment results are really not that impressive. They're rather disappointing when you actually look at the studies being done as to how much is accomplished. There's really, in the vast majority of cancers, there's no real clear proof that it's doing that much good. That's the first point. The second point is, I think it's important to reverse the question, and nobody's really doing that. They kind of take conventional treatment as a given, and then what kind of nutritional and alternative other therapies can we use in order to reduce the side effects of it? And what I'm suggesting is that maybe we should turn the question around and say, will the conventional treatments interfere with the alternative results? And if you actually have some evidence that you can get pretty good results with the alternative treatment in terms of survival time and quality of life, which are the 2 parameters that I think are most important, if you can get good results with that, if you now added the conventional therapy to that, are you going to reduce either the survival time or are you going to reduce the quality of life? And if the answer to those questions are yes, then your person might want to consider just doing the alternative things, and they can always add the conventional if the alternatives are not working. But to me, that becomes an important question, and very few people are asking that. Almost nobody's asking that. It's almost like it's a heresy to think in those terms.
Well, of course, because that's not that it's so much that it's against the rules, but it's not part of the standard of care, so they're not even going to go there. So.
Right.
Yeah. So I wanted to briefly mention a show that's coming up. You and I have spoken about it. It's not until May 6th, but it's going to be really neat with Peter Gochu, who many of you may not know, but he wrote a book about how explaining the notion that drug companies work a little bit like organized crime. And I just wanted to get your thoughts on that.
I read thank you for sending me that link. I can't wait to get a hold of that book. It sounds, and he's also, there's a little bit of a YouTube thing that you sent me, and on this, and the person, this guy is one of the founders of the Cochrane studies, a study group which evaluates various types of conventional treatment. I mean, this guy has impeccable credentials, and he is saying that the business model for the pharmaceutical industry is organized crime. Now, That's really, really, really rough. And unfortunately, he may be right, and because he presents evidence for that. And he talks about the number of deaths that have occurred, especially psychiatric deaths from various psychiatric drugs.
Mm-hmm. Yeah, I think it's really interesting, and I think it'll shed a lot of light, even though, again, it's not directly speaking of cancer drugs. I think it helps to explain why conventional medicine is not, is pushed so hard and is not always very effective.
Right.
So I think that's my tie-in, and I'm very much looking forward to sharing that with everybody, because I found it really mind-boggling and amazing. So I'm looking forward to that.
I'll be looking for that also. I'm very anxious to hear your interview with him. It should be great.
Well, yeah, it should be very interesting. And next week I have Dr. Kelly Turner, who is an amazing woman who's done research all over the world following people who have had so-called radical remissions. And that's going to be another very exciting show, because many people say, well, I'm afraid to take the alternate route. I don't know anybody who's not done conventional and survived. I heard they all die. And they need to hear that there are so many people who have declined conventional care and done far better. People who were given 3 months to live, 2 weeks to live, who turned it all around. And she has compiled an amazing book of these survivors and what exactly each person did. And keeping in mind that each person's path can be completely different. What might work for you or is acceptable to you as an individual might not work for me, or I might say, well, I'm just not going to do that. So there's different paths, but it's a really interesting book. So if any of you haven't read that book, you might want to pick it up.
I absolutely want to pick it up. I think that's absolutely exactly what I'm looking for, this kind of thing, because that's Kelly Turner, her name is, huh?
Yeah, and I'm going to introduce the two of you because you will just love each other. And she's got a whole thing called the Radical Remission Project, and she's welcoming anyone who has their story of how they healed their cancer to join in, so that there can be kind of a registry of the people that did it and what they did to get there, to really help others who want to go down that path but are terribly nervous or just very confused about all the different information out there. So I think
that's great. I'm really looking forward to meeting her.
Yeah, she's actually spoken at the Annapolis Seed Conference too, and she and I have done quite a lot together. So I will definitely be connecting you two after the show.
Sure, that'd be great.
You would love it. So I just want to remind everybody that we spoke of a lot today, and some of those topics we covered in depth from other angles on previous shows. You can find all of them on Dr. Schachter's website at the Schachter Center. And you can find them on my website, and you can find the replays also on iHeartRadio Talk under the headers Speakers or Health. That's Spreakers, that not speakers for whatever reason. I'll never understand it, but just so you can find it.
Probably a typo that never got corrected or something.
Or it must have some new, like in the new text world, people have these new ways of speaking. It has to be something like that.
Oh, maybe so. Okay, you got me.
Yeah, it got me too, but it's also under health, which is still spelled HELTH, which is pretty neat. They haven't changed that. So if you want to replay those, and of course we have, I've written some summaries from the other shows too. So if you want to read them, they're on my website as well as Dr. Schachter's. And I do encourage you to look at both of the websites because there's a tremendous amount of information there.
You just mentioned the site. The website of mine is www.schachtercenter with no spaces, SCHACHTER Center CENTER.com, and you can navigate around it, and we've got all kinds of educational things related to cancer and a lot of other topics.
Right, some great information up there. So I do encourage all of you to look at that, and I do have that organized on my website for all of the shows that Dr. Schachter's done and his website. So if you didn't catch that, it is up there. And what else? I guess this has been Survive and Live Well. Tips to treat and beat cancer on Cancer Support Network, W4CS.com, where you can listen live Tuesdays at 1 p.m. If you missed any part of this show, you can catch it on my website, www.elynjacobs.wordpress.com. Again, next week I will chat with Dr. Kelly Turner on the Radical Remission Project. So, Dr. Schachter, I want to thank you very much for giving us your time again today, and I look forward to having you back on again.
Absolutely, Elyn. I really enjoy it, and it just gets me thinking and helps me to focus my own thoughts, and it's just great to talk to you and great to be on your show.
Great. Well, we're all loving it and appreciating it very, very much. So this is your host, Elyn Jacobs, one-on-one cancer coaching, empowering you to treat and beat cancer. See you next week.